Some questions. Heather L. Owens on Instagram. What are your thoughts on stem cells to use cosmetically and otherwise?
Heather, I'm a big fan of stem cells. I think they have a lot more potential than we've uncovered so far. Right now, we're using things called vampire facelifts, where we take some of your blood and infuse it into the face to give this face a chance to rejuvenate itself. They work in part because you have these cells that are good at creating a change, but they also probably have stem cells in them. And I think we're going to get big advances, not just in cosmetic issues, but also spinal paralysis, even Parkinson's.
Buff Vexo on Twitter. How many supplements can someone safely take in a day without causing bad interaction?
Well, when you're taking more than 6 pills of any kind, there's a 50% chance you're going to have an interaction. It may not be a significant one, but it makes me worried. I personally take a supplement, but I take the lowest dose possible. I take them at the doses I could have gotten from real foods. So vitamins A, B, C, D, and A, the alphabet, again, in doses I could have gotten from carrots or lemons or whatever. And then I add a little bit of omega-3s because they're huge for the memory, but also for joints and reducing heart issues. But that's omega-3s are fish oils.
It's great for joints.
It's fantastic. Also for the brain. And then I take a little extra vitamin D because most people don't get enough, especially in the winter months. But that's my basic foundation. That's what you should be getting anyways, a safety net.
At Ken Dawson on Twitter, what's the quickest way to realize something's a scam in terms of healthcare? Is there a lot of scams going on?
I just busted a terrible group in San Diego for scamming me. They were using my name to try to sell products. You know, I don't sell any products at all. And so they were claiming I was, and then they were actually selling a product that only had 10% of what it said it had in it. So I went out and surprised them, and they ran for the hills like rats. It was fascinating to see. So here's how you can tell. First, if you have a celebrity associated with it, be dubious. Most of us aren't going to sell our names for cheap to a company.
Unless you see the person actually saying it.
Unless you say, I like this specific product. Not, I like vitamin C, but I like this brand vitamin C. Number 2, look for testimonials, especially if they're done within a couple hours of each other, because they're probably planted. And finally, if you can't read the fine print, literally, if the fine print is in a font you can't read or the color's the wrong color, they're scamming you.
Professor Marguerite, how do you keep your skin so firm?
Moisturize, moisturize, moisturize.
You have never had work done?
Never had work done. I think I need something done? Are you trying to tell me something?
No. Wrong 1, 2, 3. Why are there so many bad jobs where you see someone say, oh, come on, that's terrible?
The bad jobs happen because people ask for procedures that shouldn't have been done, and unethical plastic surgeons sometimes do it. Here's the story, I think. We don't want to look 40 when we're 80. We want to look good for 80. And there's a difference.
Right.
So I'm 53 now. I don't want to look 20. I wouldn't mind looking 40, but what I really want is to look really good at 53. That's my goal. And most women out there, if you really probe into it, that's what they want. We all value beauty. Beauty is an external reflection of your inner health. It's a barometer of how healthy you are on the inside. So you want to look good for your age, but you want to look your age.
Wrong 1, 2, 3 Instagram. Have you ever diagnosed a patient and then you were way off?
Oh, I've made plenty of mistakes. Every doctor has.
Second opinions are important then?
30% of the time, a second opinion will change your diagnosis or treatment. I'll say it again.
30%.
1 in 3 times, the second doctor will either disagree with the first doctor's treatment or the diagnosis. So please get a second opinion. It is the best way to make the system better. Patients are intimidated about asking second opinions. Please don't be. It makes the system better. You're like butterflies fertilizing the flowers of medicine. We become better doctors if you come back to us and say, you know what, I asked another doctor, and he said, well, maybe I should do this. It will always inform us, and every other patient we see will benefit because you were brave enough to push back on our diagnosis.
Jeff Abramson on Twitter, what's your workout routine?
I do 7 minutes of yoga every morning to stretch myself out. And I do 100 push-ups and 50 jackknife sit-ups. Then I'm off to work real quick. At nighttime, if I have time, I'll do something active. But my real workouts happen on the weekends, where I play a couple hours of basketball in the morning, or tennis, or something else where I can beat someone, or I can get beaten by somebody. I like to compete a little bit. And then I do longer workout sessions with my wife. It's one of the things that I think brings us together. Because in yoga, it's not about how loose you can go. The looser you are, the more you're a loser. It's more about experiencing it.
Watch new episodes of Larry King Now, Monday through Thursday, on demand on Hulu and Aura.tv.